Non-adherence to medications is linked to 10% of all hospitalizations and 125,000 annual patient deaths. One of the biggest reasons for non-adherence is the cost of medications. I'm Carleigh Krueger, a pharmacist at Salina Regional Outpatient Pharmacy.
Carleigh, thank you so much for coming on the show. We're going to be talking about medications. In particular, I want to talk about, medications are not cheap. What are some things that you do as a pharmacist to kind of maybe educate and help the patients out?
So I work in the pharmacy in Salina Regional and help a lot of patients that are discharging from the hospital. So often they're started on new medications that they haven't been on before. And one of the things that we'll do is make sure that they know the cost of the medication before they ever leave the hospital. And there are sometimes resources that we can find and help the patient obtain to make those medications more affordable. So one of those things we'll do is if a medication is simply too expensive, we'll try to find a therapeutic alternative. So a medication that's going to do the same thing but might be cheaper for the patient. The other thing that's sometimes available is coupon cards or copay assistant cards from the manufacturer. So we try to sign patients up for those and help them reduce their copays if those are available. And we actually have a new resource for patients that don't have any insurance and who fall below 300% of the federal poverty line called Dispensary of Hope.
Let's look at the Dispensary of Hope a little deeper. Where did this come about?
So Dispensary of Hope is an organization that the outpatient pharmacy has partnered with. It is an organization that gets donations of medications and then distributes them to pharmacies and clinics across the country. And we are able to give these medications to patients free of charge. So a lot of maintenance medications like insulin, inhalers, blood pressure medications, patients can get completely free. And it's medications that otherwise they might not be able to afford that can really help to improve their health.
Let's talk about if somebody is eligible for Dispensary of Hope. How does that process work?
So we're relatively new in this process, and what we've been doing so far is if a provider or another pharmacist, like we have pharmacists on each of the floors of the hospital and then also in the clinics, if they find a patient that they think might qualify, they can give their information to us, and we can reach out to the provider to get prescriptions for medications that are available through the Dispensary of Hope.
Carleigh, I know one thing I found interesting from some of the data you gave me was that it was showing that participants in the Dispensary of Hope showed a 20% drop in their inpatient readmissions.
Yet non-adherence to medications is a huge part of reasons that patients are actually readmitted to the hospital. So Dispensary of Hope allows us to provide these medications to reduce some of those readmissions and reasons that patients have to come to the hospital.
Thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.